One was on obesity, second on sexuality, and third, the father of both sessions, structures. Because regeneration potential plays a major role in every aspect. You might have heard from both of them. Let nature heal, don't manipulate. Both of them have conveyed a message. Let nature heal, don't manipulate much. That's what the regenerative medicine speaks about. In fact, on a working day, to have an audience of surgeons who are clinically practicing their own, having such a good audience, I'm really impressed. This shows the interest which makes me more motivated, and I think I try to take this journey more better, more attractive, as well, maybe more knowledgeable. It was an excitement for me to come here today. For one reason, it was like coming home. I passed out from Ambejovai, migrated to Bombay, from there to US, then Europe, did my all trainings in different sectors. When the biggest challenge for the journey was, I was a clinical surgeon and I was going towards a research. This is a big tough journey for me. And that too at an age where people think retiring. I was then 50 plus when I started working on the science. This is a big challenge for me. And I always believe in one concept. When you start new subject, you should know the basics of it. So I thought to undergo myself in a training of tissue engineering in the labs. So I took my tissue engineering in Bangalore. That made me to understand what is life. When I started seeing these microscopic cells under the microscope, which are making us our life, how important they are, how they can make you feel healthy if you try to work with them properly. They are the ones who are treating your diseases. As a clinician, and a researcher, I could value those cells in my application, how I can utilize those. I started calling them as living drugs. And I started comparing how these living drugs can be more challenging, more better than a pharmacological drugs or non-living drugs. This is one concept which made me motivated more move toward research of stem cells. During the course of this research, I was in Ohio State University working with some of the best, or what you can say, Nobel laureates or pro-Nobel laureates. The reason of saying for you, this is very important for you all, if you note it, that environment makes a man. Man doesn't make anything. My clinical application started changing towards research when I started working with these renowned researchers in US. This is a team of mine in US who does a clinical trial work for me. I'm working on a team called as retrospective study in avascular necrosis. This is approved by WRB in US. My co-partners are Ohio State University. This was my training in the lab in US. This is my team who turned me. Dr. Sain was one of the mentor pioneers for me to train this. After having this training and my work done on autologous stem cell therapies, utilizing for treating untreatable conditions. When I'm talking untreatable conditions, means where you have failed by conventional method to treat these patients. I'm not going to talk on any kind of disease which are going to be treated by conventional methods. All those patients who came to me, they have failed by conventional methods. And we have asked them to leave as it is. There's no choice for them. I presented a study of around 500 patients of different subjects like orthopedic, neurological, autoimmune diseases, and I showed them the results You carry your repairing kits in your body. This is my very favorite sentence, which I always use to my patients. Take care of your body because they are carrying stem cells in your body. Care for them. They are going to heal you. No other medication in the world can work better than your stem cells in the body. And it was highly appreciated. Then I was awarded with certification in Ohio State. This was very adoring. They had arranged a special training program for me. Then I worked with Luke Montelier. I spent 3 days with this Nobel laureate who has worked on HIV. This is a team in San Jose from California with whom I am working on a clinical trial, particularly for diabetes and osteoarthritis. Again, this is a WRB approved project. Dr. Sen is mentor for me. For everyone you need someone. He's an Indian guy, not even 40s, but he's a guy who holds the authority in the US to shake hands with the president of US. He's such a caliber person and who has changed my thinking process towards the research. And I have transformed myself from a clinical surgeon to clinical researcher. And I have learned one concept from this. Every clinician should be a researcher if he wants to be a good practicing doctor. He can change his practice, he can give wonderful results, because ultimate aim of all of us practice is to give good quality life to your patients. If you can go with this concept, I believe you all will change the idea of being just a clinician and add to it a researcher. No science is born in one day. Every science has a history. So stem cell science or regenerative medicine has a big history, very big history. If you see our mythological books, mythological histories, we speak of some cells. I don't want to talk on the topic much, but I think a little faster here. Prometheus is a Greek history. Most of them may be knowing what is Prometheus history. Jesus was their god. And Prometheus was working for him, and he stole the fire from his god and gave to the human beings. Which god Jesus felt very bad. He was annoyed and he was punished till death by eagle to eat away his liver. He knew liver is the fastest regenerating organ in the body. Liver used to itch his liver every day, but he never died. He suffered with the pains. Carl Ernst was the first person who researched out 100 years before stem cells. It took 100 years for bench to peg. It's a big journey. Why it took a long time was because all scientists tried in vitro to culture the cells, but it was a very difficult challenge at that time. It took a long time and human beings could not be used as a model for the trials. It really privileged to tell you, it was a time in 2012, it came as a low light when Shinya Manika and Gordon got the first Nobel Prize for biological age reversing from embryonic, from adult somatic stem cell to a biological embryonic stem cell. Embryonic, we all know science goes in one direction. It cannot be reversed, age cannot be reversed. We know all chronological calendar age, biological cellular age. The cellular age was reversed from an embryonic stem cell, from an adult somatic cell to an embryonic age by inducing just 4 transcription factor, and he was awarded to Nobel Prize. The second Nobel Prize in stem cell history which he got. First was when the WCHIP 1996 story. So that is how the journey started. Both of them were working together, Gordon and Shinya Manika. And let me tell you, all these people which I am talking to, most of them are surgeons. Shinya Manika is a spinal surgeon. Anthony Atala is a urology surgeon. All these people are surgeons and they are researchers. Anthony Atala is known for his tissue culture labs. He is one man who has developed every organ in the lab which are waiting for transplant. Just a few will talk to you. When we are looking how this science has progressed, let's see why I am talking about this is that we need to change ourselves. The era initial was before modern medicine. The average life expectancy was not more than 20 years. People used to live, born, become young and die. The reason was that no sanitation, People believed in superstitious things. Health was very bad. People used to die. Even you talk the emperors who went for the world winners, they not lived more than 30 years. Real change came in the age was when antibiotics, vaccines, sanitations came to the picture. Life expectancy increased up to 49, 50 years. Simple, smallest thing, but then even to learn why antibiotics and vaccines were so beneficial, it took for research of more than 100 years. And physics was a major role, played a major role to understand what are the actions they are taking place and how they are benefiting. Now, I'm looking towards the third science which is coming up, which we call as genomic science, molecular science, or regenerative medicine science, or stem cell science, whatever you can call. Health crisis is a factor which I always talk in my every talk. We all know in your practice you have come across, as I said we tell the patient, autoimmune disease, I cannot do anything. Spinal cord injury, we say I cannot do anything. Genetics, we cannot say anything, we cannot do anything to the patient. These are many other conditions where we really spend billions of rupees, lakhs of rupees on the research. What happens at the end of the day? Cancer, what happens at the end of the day? You go for any of the most modern drug, cancer therapy, patient comes back a bouncing effect of metastasis. So I look forward at this stage as a health crisis. With this health crisis, with modern medicine, we have increased our life, definitely. But don't forget, all 40 plus, 50 plus, they live up to 70, 70 plus, 80 plus, but all with diseases. Diabetes, Deepak has well elaborated. Obesity is a gift. Lifestyle. All these are disease-added aging, make your life more dependent and non-treatable conditions, and you become handicapped, a big burden to the society, big burden to the family world. So I always say, the limitations of the current treatment you should keep in the mind. And then you have to think, what else I can do? What else I can do to work on these limitations? Yes, dear friend, you need to have a disruptive innovation. When I talk disruptive innovation, you have to understand two concepts. A proven science and unproven science. A proven science is one where we are practicing and saying approved science. Approved science has got its own limitations to practice. And unproven science is one with the biological science. We forget, I spoke the word living drugs. Living drugs are the cells. And believe, living drugs can only heal all those conditions which non-living drugs cannot heal. So we need to think of parallel thinking. If you don't think parallel thinking, a very nice Albert Einstein has said, we can't solve the problem by using the same kind of thinking we used when we created them. What do you do? Autoimmune diseases, we are coming up to monoclonal antibodies, but what does happen? Ultimate, 10 days benefit, 15 days benefit, 1 month benefit, bounces back again. Patient comes with the same disease back, same pain, same condition. So we need to change the foundation and we have to move towards the living drugs. And that will bring the solution to all these kind of problems. Difference between a drug molecule, pharma molecule, and a drug, difference between a regeneration. Here we are talking of regenerating the tissue, repairing the tissue, not treating the signs and symptoms. We take insulin, does mean manufactured in the factory. We never thought, can we regenerate the pancreas? Can we make our own factory in the body functional, pancreas, beta cells? Yes, we have to think on this. This is called the parallel thinking, or thinking beyond common lines, and then the solutions will always come. Challenges are always there. For any science you take any science when it comes as a new, challenges are always there. New innovations are keeping coming. If you see, US is the world's largest country having the largest innovations. But how many innovations are practiced in the clinical practice or a common man's life? Very few of them. Very few of them. Any innovation survives, lives, and benefits to a common man can be only practiced. And such practicing innovations can be only backed on the back of politicians' backup, or a financial backup, or an industrial backup. The target of this innovation should be to reach to a common man, so that this new innovation can change the life of a common man. This is what the idea I am taking always whenever I talk. You need to think how I can take this science to the common man, and then only science will survive. Otherwise, there are many innovations during the course of time gap, they disappear. This is one slide when we define the stem cell. This one will cover for everything. And the first picture of the stem cell, if you see, single embryo which forms sperm and ovum. This is where I always say, ask yourself where the stem cells come from. Where the stem cells come from when we talk. Where do they stay in our body? What are the jobs they are doing and how they are functioning? There are many questions. If you ask your body, you will get the answers to them. The most important is that it is birth with your birth. The zygote is a birth of your master cell of your body, which is totally potent, has got a potency of going into cloning, completely cloning. I'll go a little faster. Then it goes to an first differentiation, CDX2 is first differentiation comes in where the blastocyst comes in. Up to this the cells remain as a totipotent, and then comes the pluripotency to the cell. Pluripotency indicates it can make 220 types of cells in the body, and totipotency includes 220 plus placenta cord, everything can be generated. That's what we call a cloning story here. Then comes the pluripotency, then comes the adult cells. Fetal adult cells or cord cells, or even cord blood cells, or genetic cells, placenta cells, or bone marrow, or adipose tissue, or amniotic fluid. All these are adult cells, but they are misnomers. We can't imagine why we call them adult cells, because they are tissue specific. They are tissue specific. They are already committed to become something. So we call them tissue specific stem cells. These are the same definitions which I described, like totipotent, pluripotent, multipotent, embryonic and adult. There are the two differentiating factors. The embryonic is only when pluripotency up to the blastocyst stage we call them, and after them we call them fetal stem cells. Again they go in the category of adult stem cells. Cord tissue cells, even they become bone marrow cells, they become adult stem cells. This is the same thing slide. What is the differentiation methodome? Adult stem cells, let's focus more on, so I'm not going to talk, the area of my work is not embryonic, I work on more of an adult stem cells, that too autologous stem cells. The application sources, as I said, they are not available in the shops anywhere, they are available in your body. So we need to always talk to the patient, your bag is your body, maintain it more healthy. You are always carrying stem cells with you, whenever you want you can use them. This is one very important when we talk of a stem cell. I had asked you a question as to where do the stem cells reside in the body? Yes, they have a niche. They have a niche. Every organ has a niche where the stem cells reside. The bone marrow has got a niche. Liver has a niche. Then follicle has a niche. Both the cells, the surrounding somatic cells, act as a niche cells to them to give signals of differentiation. If the somatic cell doesn't give a signal, the stem cell doesn't differentiate, it remains quiescent and immortal in the life. It dies with your death. It doesn't differentiate others. It has to get a signal from a surrounding somatic cell, then only it can differentiate. The signals decide the fate of a cell, what to do, what not to do. That is the reason when we give a same mesenchymal stems in the liver, the environment decides whether this cell has to become a hepatocyte. The environment decides whether the same cell has to become an osteocyte, chondrocyte, myotubule, neurocyte, neural cells. The environment, the stem cell doesn't decide anything. So we need to work on a niche of a cell, which is very important. Once you know the niche of a cell, how it is to differentiate it, what the factors are required, you can manipulate them the way you want in endogenous organ, which means the body also. The healing power, this is one slide which I always show, is a nature's healing power, the couch which the fish is eating. Now in these animals, predator animals, even if they lose the hair, eye, salamander, if they lose the leg, it regenerates completely. There are blastomeres in the cells which play. Along with that, there is an IL-2, and along with that, one more important, macrophage 2. They play a more part in regeneration potential, but which we have paid a big cost of super specialization. We are super specialized persons from animal to us. So we have lost that power of regeneration, and we have only power of repair now. So why can a man cannot go back to regeneration potential? Yes, they can go. It scientists worldwide, they are working. There are scientists in the world who has regenerated the complete finger. If you cut the finger here, the finger will regenerate using some kind of ECM factor. That is being done, and people are doing it. Even if you see a small baby when it is born, within 3-4 days, even if the baby loses the tip of finger, the entire fingertip regenerates. But the same potential after 15 days or 1 month is lost. There plays a IL-2 play major role, macrophage 2 plays a major role. So can we retain these powers, or can we bring those powers by using some or other methods of regeneration potential and become immortal? Scientists are working on that, and they call it is possible much. It is called as a God DNA. This is one thing, how to heal in the, I told you the repair power we have got. We don't have a regeneration power. This is just a slide to show you repairing potential in your body. In this slide, if you see, if we replay the third slide where the inflammatory cells are coming, instead of inflammatory cells coming in the picture, if you bring in cells of stem cells at that level, along with macrophage 2 and IL-2, we will not form a scar there. We will not form a scar. Scar is an extracellular cellular matrix which is released by the fibroblast. If we remove that part of the healing process, we also can get the healing powers of those things. Applications, if you see, stem cells can apply in almost all regeneration potential, because if we don't have stem cell, we die. If you don't have stem cell, we die. The simple principle of stem cell is that you talk of a hair to nail, every part of the body has a stem cell, that is why they are maintaining. Even if you go retrospectively, our clinical teachings in medical schools are changing now. We were taught neurons don't multiply. We were taught myocardial cells doesn't multiply. Present scenario says, yes, neurons multiply. Yes, we have in our own labs. We grow neurons in our lab. Every tissue in the body multiplies. Myocardial you can grow. Everything can grow now. Not only for that, these cells has a potential to disease treat all untreatable conditions by the conventional method. These are the different conditions where autoimmune disease, multiple sclerosis, muscular dystrophies, ischemic gangrene, in cosmetic have got a major application, diabetes, orthopedic, neurological conditions. All these conditions, they have great applications. When I started with 1 or 2 diseases. Today I am treating more than 80 type of different diseases with very good results, and using only autologous stem cells of your own body. That is what I call eukaryotic kits in your own body. Use them properly. You don't have to manipulate them, you have to grow them. Just use them with proper protocols. Make a personalized, customized treatment protocol, and I'll assure you, you will get wonderful results. These are various applications and sources of the stem cells. If you see the worldwide health money spent in a different ratio in the pharma industry, even if 1% of this spent on the research on clinical trials of regenerative medicine, all about diseases can be treated, which I mentioned well. For all those conditions which I was mentioning, just like bypass surgeries or heart surgeries, autoimmune disease, organ failure, knee replacement, cosmetic surgery, where there are no much results, we are spending billions of dollars. Billions of dollars. You take an estimate in India, whether it is US or any other country, the cost is escalating for all this treatment, but there are no results. The same thing can be reduced cost as well as good results. Here I am showing for you one reason why stem cells play a major role in our healing process is as when we are born with full strength of stem cells. As we grow older, our stem cells are reduced. At age of 16 to 17, we are around 40 billion cells in the body in circulation which are maintaining a wear and tear. Reason you should remember, every adult cell has to die. Every adult has every adult somatic cell has to die. There is no choice. If it is not replaced, organs lose the functional abilities. That is called as organ aging, biological aging. If you replace those dying cells in a ratio of what they are dying, you can maintain your aging process with youth up to 80 years, 100 years. Okinawa, Japan's small state, centenarian state, people live 100 plus. Still, you will find a 100-year person walking and driving the vehicles. It's a matter of how you live the life and how you use the stem cells to make you immortal. These are certain my practical experiences which I'll take it for another 2 minutes and finish it. There are certain my practical experiences which are the conditions which were treated, like the diabetic gangrene which was treated with the intra-arterial application of the stem cells. This is a burn case which 80% with a full deep neck burn. We use just the stem cells along with some cytokine factors, and if you can see, there is no even scarring or contracture formation there. This specifically for neck I am showing you, reason being that this is a healing process where you definitely form a contracture. Elephantiasis. We have never seen a person elephantiasis being treated anywhere, and we have not heard the book has written. Use stem cells, his neoangiogenesis will take place, new lymphatic vessels will proliferate, and the entire wound is healed with healing of ulcers also. This is one video which adults show that this is one girl recently we treated. This is the youngest girl in the world, 14 months, for cerebral palsy, treated at StemRX in Mumbai, where we gave her stem cells intrathecal along with oxygen therapy, and the baby showed a drastic weight gain, muscle tones, neck holding, and the baby started even feeding properly. Not only that, she is developing like a normal